pathology is the gateway to treatment. I like to call them unsung heroes of medicine.
You really can learn rare tumors and rare presentations of common tumors, because this is when we as pathologists struggle the most.
But that would be super cool for me as a patient, because I would have an option to basically look at my case on the internet.
And eventually will help patients to make better diagnosis and better treatment.
Welcome, my digital pathology trailblazers. Today, my guest is Dr. Yuri Nikiforov, and he is the founder and president of World Tumor Registry. And the World Tumor Registry, as the name says, is a world registry of tumors. And the first time I heard about it was from Dr. Andrei Bychkov, who is he, Yuri, in this project? He's an editor, right?
Yes, he is one of the chief editors for the thyroid WTR.
Exactly. So I met him in person, and there is a little video that we created, but today we're going to go more in depth what it is, why Yuri, you and the team created it. But let's start with you. Tell the digital pathology trailblazers who you are, what's your background, and how did you end up where you are right now in your pathology career?
I'm in Pittsburgh, Pennsylvania, and I'm here run the division of molecular and genomic pathology. I am AP pathologist by training with interest in thyroid pathology. And my research, clinical interest is in thyroid pathology and in molecular diagnostics. So that's sort of my background. And I'm originally from Belarus and been living in the United States for many years. Very interested in, obviously, pathology education, in really seeing the young generation of pathologists coming, and taking over and pushing our field forward. And one of the reasons why I got interested in creating something new was exactly that, to really promote pathology education worldwide.
Mm-hmm. And I don't know if people see, I don't have my thyroid because I did have thyroid cancer. And before this podcast, we were talking like, how could we get hold of my slides? So maybe next time I go to Poland, I will try to find them and I will document it. And then we can put it in the World Tumor Registry. But so let's talk about what it is. Let's start with what it is. And I have it on the screen for those who are listening. If you go to YouTube, you're going to see everything that we're talking about, also in visuals. But yeah, why? What is it? What is it?
You can think about World Tumor Registry as a sort of Wikipedia of human tumors. At least that's how we want it to be at the end when we complete this project. And like Wikipedia, anyone in the world can freely access it. Just type worldtumorregister.org and open it, through Google or as a driver, and start browsing or contribute cases if you would. So, sort of similar to the Wikipedia that we all know. It's a free available resource where many people can contribute the digital slides, information related to them, but the difference is that it is heavily curated. It is curated and annotated by the editors, by a group of experts in the field from different countries in the world, to be sure that the diagnosis is correct and all information provided is also correct.
Mm-hmm. And your goal is to have all the possible tumors in the world. Because of your expertise, you started with the thyroid, right? And I see that the next candidates would be breast and lung cancer. Well, we can do the demos and start talking about what's already there based on thyroid tumors.
Correct. Our first project is thyroid because this is a prototype, if you wish, that we create to show how we see the future of this project. And in the next two that we are about to announce that we start building them will be breast and lung. In general, the idea is that the World Tumor Registry will be a collection of individual tumor type. We will build all the way until we have all 18 major tumor type here in the collection. And when the visitors will come to the website and they will look at it, you can click on any of the tumor type. Now you can click on thyroid, for example, and it will take you to the thyroid tumor registry. And then you can start searching it. You can search it by diagnosis. If you want to see how specific tumor type looks, you will go ahead, click on search by diagnosis, and you open this field. And here you can go ahead. You have to acknowledge, yes, that you will not use it for direct diagnostic care. Why? I mean, why we really wanted to create it, and what is the difference between this and many other databases existing? This is a true world collection of tumors. It's contributed from many different countries, from almost all regions, and this is our goal. One of the big questions that we want to be sure of is if the human tumors look exactly the same in different countries of the world. I'm glad that you show this map. This is map of thyroid editors. As you can
there's
see,
a map on the website from with dots where all the editors, and we're going to talk about the editors and the process, because everybody can contribute, like you said, but there are specific rules how to contribute. So it's all over the world.
So it's all over the world, and even we have editors located in the different regions, and they also sort of will solicit cases from their even neighboring countries. The idea is that most countries and most regions in the world are included and covered by it. And then when you search, for example, tumor type, you can, if you, for example, go and say papillary carcinoma, for example, in that box on the top.
Yes.
So it will show you the representation of papillary carcinomas. And then, for example, you can search by geographic region. Let's say you want to see how this tumor look in specific region of the world. Let's say in Asia. So you can go and you can filter it. You can filter it by region or by age, for example, or by gender, and really select those cases that would be closest to your home or closest to your population or to the age groups that you want to see. And then you can click on individual thumbnail, and basically it opens the slide. You can click on any of them.
Let's check this one. Papillary carcinoma. You basically have a whole slide image viewer, and the interesting thing, like, you don't have to log into this. You don't have to give like any credential, and you have the information about this particular tumor that we just searched for. So it was Asia, papillary carcinoma, and you can just go and browse this whole slide image. And there is a bunch of case information. What kind of information do you guys include in those cases?
So we provide information on diagnostic features. So this is infiltrative follicular variant, so how to diagnose it. Then we share information about where region it is from. For example, this is from Asia and Oceania, from China. Then basic demographic information. For example, this is 40-something year old female with no family history, with no specific environmental setting. And then tumor stage is a certain stage, cytology available, and in many cases genetics and immunohistochemistry if available. So it really gives you a sense of how the tumor look, and also what diagnostic or immunohistochemical or molecular characteristics that this tumor has. I also want to stress that at the end of this sort of metadata strip, you will see also contributor and editor. So we encourage pathologists from all over the world to submit your own cases, cases from your practice, into this global resource and contribute to the world collection of tumors from your region. And your name as a name of contributor will be acknowledged, and credit will be given to you as the contributor, as the owner of this specific slide. Not slide, but case.
So let's say I will find my tumor slides, or maybe even the blog, as we were talking about, to get the IHC and get the molecular information if we do these exams. But then what happens? Give me one second.
What happened? You go to the, again, WTR website, to the if you can go to the landing page, and you scroll. First you can search, and then you see submit case.
Wait.
This little bit above.
Okay, yeah, I see submit case.
Submit case, okay. And then you look at the world map, and you select the editor that is located closer to you, closer to your region. You can click on any of this. You select one editor and you click on a circle.
Let me check. So there's one close to Poland, and this is Czech Republic, okay. And Dr. Alice Ryska is the editor, right?
So you see, you click on it, and it shows you this field where you can put your name and already pre-populated message that Dr. Ryska, I'm interested to become a contributor. Please send me the link. And you click I'm not a robot, and you submit it.
Okay.
And the editor will receive your email and will send you a link. Using that link, you can go in. You, as a contributor, you have to register, but it's obvious. I mean, it takes you 2 minutes. You register, and you are ready to upload the case into the World Tumor Registry. After you upload the case, it will go to the editor for review, and he or she will let you know if case is complete or you need more information, your quality is acceptable, and so on and so forth. And if everything looks good, he or she will send it for final approval to the editorial board, and when it's approved, it will appear in a public folder and available for everybody to search, to see, and to learn from that case.
So a few questions here. First of all, I need to upload the whole slide image of this case, right? Do
Correct.
We have any requirements? What kind of image does it need to be? What magnification? Is 20x okay, or does it need to be 40x, or are we flexible?
All very good questions. We require 40x magnifications. We are building it for the future. We eventually will have AI help in recognizing and matching the images. So we require 40x resolution. I know that it's a limitation for some areas, but again, it has to be. This is the only requirement that we have. The case get de-identified during the uploading, and also will be further reviewed by editors to be sure that there is no patient identifiers present. We require a number of metadata, like patient age, gender, minimal. There is no requirement. If some of this information is not available, this is not a problem to upload it. Fundamentally, we need a high quality representative digital slide in order to accept this case to the WTR.
So once I get hold of my slides, I will have a way to digitize them. But what if somebody can contribute a case, but they don't have an option to digitize? Is there an option to send them somewhere for digitization? Did you guys think about it? Did you have cases like that?
We are actively thinking about it, and I want to remind everyone that WTR is still pretty young organization. We were incorporated as a nonprofit in 21, but we went live in March of this year, 2024. So this is on our list to create centers, like you said, for digitalization, particularly in the areas of the world where scanners are not so easy to find. Right now, it works in a way that who has an interest in or rare case has to contact the editor and ask editor to scan the slide on their behalf, which virtually all editors can do.
Okay, so basically, if I want it, let's say I can send my slides to Dr. Rishka and he has the ability to digitize them,
That's
which,
correct.
I mean, I would be a contributor and a patient at the same time, but that would be super cool for me as a patient because I would have an option to basically look at my case on the internet. I mean, I would know that it's mine because I submitted it. Other people would not know that it's mine.
That's
But
correct.
but let's say let's talk about it because let's say somebody let's say I was diagnosed with I think it was follicular carcinoma, so I can go there and find follicular carcinomas and ask a pathologist, can you show me the features of the tumor?
That's correct. This educational resource has several potential user groups of potential users.
Yes, let's talk
Obviously,
about them.
the main still pathology trainees, because I mean we believe that this will be enormously helpful resource for people who are in training, particularly when we are talking about learning some rare tumor types, because there are a number of common tumor types, but there are some very rare. I give an example: is angiosarcoma, thyroid angiosarcoma. I've been practicing for close to 30 years.
Let's
In
find
real
it.
life, I've seen maybe 2 cases of thyroid angiosarcoma, And then here now, if you look at the registry, if you, for example, want, we can also take a look and we see we already have several cases. If you can go to tumor type, and you will see common and then uncommon tumors, second group.
Common, and then we have uncommon, and I see the angiosarcoma.
And you click on angiosarcoma.
We search, and there are literally 5 cases? 1, 2, 3,
Already,
4,
you see,
5.
I tell you, in all my practice, I've seen 2 cases.
How many years have you been practicing, Yuri?
Well, I've practiced in a good number of years. And just out of curiosity, if you go on in the upper right corner, you can switch to a different. Yes, click on the next. Like next format. Yes, this one.
Mm-hmm. So we can switch on a list mode. We can see the thumbnails of those tumors. We can have a list with that is sorted by metadata, and we can see which country these tumors come from.
Exactly. You see, it's from Brazil, United States, South Africa. So from really, that's what really. So again, I mean, talking, and you can click on any of these cases, for example, to further to look. You see, so basically, this is a rare tumors, and imagine pathology trainees going through their sort of educational activities, and they want to learn how thyroid angiosarcoma looks. You see, I mean, that would be the amazing resource. There are already 5 cases, and at the end will be many more because we are still at a relatively early stage. And you see how this tumor looks. You see what patient age, and how you see immunohistochemistry here, how it is, and even immunohistochemical slide. So truly, this is the way. That's where we feel that it will be a major breakthrough in training and education. So because you really can learn rare tumors and rare presentations of common tumors, because this is when we as pathologists struggle the most. Okay, so one application is for pathologists, pathology trainees, and even practicing pathologists when they see something that they are not sure what is this. And we also maybe later talk about another search engine which use microscopic features. I think that's also very exciting. We can
yes,
look now.
so currently we can search by basically by the metadata, by text, by organ. Currently we have thyroid, but there is already other candidates. Question: how long did it take you to assemble the thyroid, and how many cases do we have there at the moment?
So if you go again, start from the very beginning, you will see it's 800 something cases. So, but these are all good questions. It took us about a year to assemble the editorial board and prepare the backbone platform, which now will take much less time to start uploading cases. So, but sort of finishing sort of this, sort of you can see. So one group of users are pathologists and pathology trainees who can search it by diagnosis, and we already saw how we can, who can search specific cohorts. What are specific cohorts? For example, in thyroid, we know that there are tumors that develop in children after Chernobyl accident. Okay,
Yes.
so if you,
I suspect mine was from this cohort.
So, and these tumors, they look a little bit differently. That will be another very important application. If you, now there are about 20 cases of tumors in post-Chernobyl, somebody can go and look specifically on this cohort. And to your question, you see total cases 805. So we have now 800 plus cases. The goal is, eventual goal, when this registry will be full, thyroid register, we expect to have between 3,000 to 4,000 cases, and with all this information from all over the world.
Per organ.
Yes, per organ. So it will be only for thyroid. So it will be 10 angiosarcomas and 10 plus thyroblastomas, which are exceedingly rare tumors. And there will be hundreds of common tumor types from all over the world that you can search. You can search by location, by region of the world, by age group, by environmental setting, but by anything you want to really come closest to something that you really want to study and understand better.
So how do we find this post-Chernobyl cohort?
There are several ways to do it. One, you see here is written environmental setting.
Yes.
Go there and check, if click and see if it's expanded, and will show you the post-Chernobyl.
It just says environmental setting, yes. I don't know.
So this is one way to do it. The second, the easiest way is if you go back to the screen when there is like 3 different search options.
Oh, search specific cohorts.
Right. Click on search specific cohorts.
Oh, and there is post-Chernobyl thyroid tumors. View cases.
Okay, and right now there is only one, but eventually will be more. And then you click on this. I'm not sure usually why it takes a long time, but it should be close to 20 cases we have now.
Yes, it's 21. I see it. See, this is typical case. So I'm reading one. Typical case of post-Chernobyl pediatric thyroid cancer developed early 5 to 7 years after exposure. Mixed follicular papillary. So I had my tumor diagnosed when I was 20, maybe 21. Now I'm 40 years old. Would this still qualify? And I was born in 84, and the catastrophe was in 86.
You were in a very vulnerable age, because the younger children were at the time of Chernobyl, the higher risk of developing cancer. It's still low, but it's higher. So follicular carcinoma is not most typical, but I suspect that you probably had follicular variant of papillary carcinoma. This is more likely.
I will find it. Now I'm so motivated to go back to the hospital and get the blocks.
And also, by the way, most of the tumors associated with radiation exposure, they are driven by gene fusions, not by point mutations. So for that reason, this is also another indirect evidence that this is more likely to be associated with radiation exposure.
So if I get hold of it and we can do molecular, the next gen sequencing, then we will be able to say with higher probability that it was associated with the Chernobyl catastrophe.
That's correct.
Interesting.
Yeah,
go ahead.
If we go back and we complete this sort of discussion of how it's helpful for trainees or for even practicing pathologists.
Yes,
if you go, please go back to the screen. To the screen where there are 3 search options, and I just want to show another, and we look at the third option. So imagine the situation when a pathologist or pathology trainees look at the case, look at the tumor, and not sure. There are some features that are recognizable on the microscope, but she or he is not sure what really we are dealing with. This is kind of a help which eventually we hope to supplement with the AI function, but now is, so-called human intelligence. So this is a classifier based on my 30 years of experience in looking and diagnosing thyroid tumors. Pathologists should go ahead and just fill out these few questions. You see, patient age,
so for example,
family
age,
history,
let's say
and then a simple thing: tumor capsule, yes, no, growth pattern, features of nuclei. If you want, you can click. I mean, it will be random, sort of, and if you go through it and just click
I know
on
I
this,
did have a capsule. I remember. So I actually, I had one of my thyroid lobe removed with the tumor, and then I remember taking it to my anatomic pathology professor at vet school in Wrocław, and we would look at it together under the microscope, and he showed me the tumor, he showed me the capsule, and he showed me how it was actually crossing the capsule. That's why I needed to go back to the surgery room and had the other
Alex, so
lobe removed.
Let's try to say, okay, tumor capsule clip, capsule, small foci of capsule invasion only. Okay, then let's continue.
Yes.
Growth pattern. So you said that follicular. So let's assume that it's follicular. So. Follicular less than 1% papilla. Okay, you click it. Then cell shape. Typically, it's the first one, cuboidal or polygonal shape. You can click on it. Then we continue cytoplasm. Typically, it's eosinophilic cytoplasm. Okay. And remember that you don't even need to click on all of them. Then nuclear appearance. Here is a question that either it was monomorphic uniform or it was significant variability in size and shape. Let's say it was monomorphic uniform, or okay, and then nuclear size small, if we believe that this was follicular carcinoma, small, and nuclear shape round, and nuclear contour smooth. And again, you see there are multiple round and smooth, and nuclear chromatin, let's say first or second. Let's clump course. Let's use the second one.
Nuclear chromatin clump course. Okay.
Okay, and then nucleoli. Let's skip. Let's say you are not sure what to do. Let's do the experiment. You don't say anything. And then tumor necrosis you didn't have. So last one, no necrosis. Some of our bodies, no. That's pretty much enough. Then scroll to the bottom and click, scroll to the bottom and click predict diagnosis.
Okay. 93% thyroid follicular carcinoma, minimally invasive.
Okay. So, and then you can click on this view, and it takes you to this tumor type in the registry. And you can see then how this tumor looks. This is a helping tool that we are building for pathologists to make them better, not only learn, but also better diagnose cancer. Okay.
Okay. So we have 13 cases here that we can look at. And that was, almost 20 years ago. So I don't remember anything else from that one slide. I will try to find them at home. But okay, fantastic.
But coming to our conversation, so this is one group of users. These are pathology trainees and practicing pathologists. The second group of users, we believe that it will be helpful for cancer researchers who can really come and study to see how tumor looks under microscope, associate them with the metadata, with the age, with the location, with the geographic region, with the environmental setting, and so on and so forth. And then the third group of users, we believe, are clinicians and patients. So if patient come to clinician, a patient get diagnosed with a rare tumor, I don't know, hyalinizing trabecular tumor, and patient wants to know how this tumor looks, and how, like you said, based on what features it was diagnosed. Theoretically, clinician even can open the case and show an example and with patient, or patient even by
Mm-hmm.
herself or by himself can look, and if they are interested, and to understand how this tumor diagnosed and how they look under microscope.
I think surprisingly more people that currently are even aware that they can look at it will be interested. And I've recently heard the pathologist, Dr. Leah Joseph, I think I mentioned this in a couple of episodes already. She started doing clinics, pathology clinics for patients, where she would invite the patients, and she would do it either with the oncologist or just invite the patient and sit with them on a multi-headed scope. And I'm going to have her on the podcast to talk about it as well. But they were very, very interested in learning, okay, how these cells look like, what does it make it malignant. And not only this, I don't know if I have the book in the back. Does that is Dr. Marilyn Bui, and she wrote this book, The Healing Art of Pathology. um I think because the accessibility of those slides is not that great, like compared with radiology, you always get your the X-ray of whatever bone you broke, right? And then it heals and you're good most of the time. Cancer is a very mentally difficult to handle diagnosis. You know, it used to be like a death sentence. Now we know a lot more, and we know it's not, but in many cases it still is. And on a psychological level for the patient, seeing those images and like being able to figure out, even without the medical knowledge, but talking to somebody who looks and diagnoses those, because pathology is the gateway to treatment, and the pathologists are like, mm, I don't know, I like to call them unsung heroes of medicine. Nobody, well, very few people talk to their pathologist. You usually, unless it's a cytopathologist where they are actually involved in the procedures, usually patients don't talk to them. But this pathology diagnosis, this image that they look at either under the microscope, or if they are doing digital work, then on a digital slide, is basically what determines what's going to happen next. So I think patients are going to be a big user group as well. And I cannot predict how it's going to be used by them, but I think it's going to be something important for
We hope
dealing
so.
with the disease. Yes, and giving them access uh, to the image, even if it's, you know, not their very image, but the same type of disease, and showing the features and explaining, um, is going to have a big impact on how to deal with the disease. Many people don't know what cancer actually means.
I can tell you even more. We are now
Mm-hmm.
entertaining another very interesting option. Actually, two. We are thinking that in maybe 6-7 months from now, when you go and look at the case, if you would like, for example, click on any of these cases, just
Mm-hmm.
I just want to tell you what we are thinking about.
Okay.
So you open a case and you learn how to diagnose it, you learn features, but then next to the diagnosis, you see here papillary carcinoma minimally invasive. Next to it, there will be two buttons. One
Mm-hmm.
will be linked to the video how to diagnose, where it will be a person who will describe how really this type of cancer is diagnosed. And but most, even more exciting, the next to it will be treatment. It will be a video. It will be a video to the link to YouTube channel, WTR YouTube channel, where endocrinologist or endocrine oncologist or surgeons will describe how this tumor type is typically treated. That's even more information that we are going to embed and provide for the users.
This is going to be super empowering, both uh, for the doctors and for the patients, especially now in the time of AI, of accessibility of all information. It's no longer like the doctor is no longer the gatekeeper of the information. The doctor is your guide into, okay, what are the options? And ultimately you decide what the options are. And you know, you can decide for the classical treatment, you can decide for a totally alternative treatment. They, like, you know, there are cases of everything. And the doctor is now your guide, um So I think it's going to be such a great unifying tool for physicians, pathologists, oncologists, and cancer patients. I think it's going
That's
to be
what we
a
hope
really
for, and we hope for people recognize importance of it and help and support also us and support our mission, because one of the fundamental principles of this organization is that we want to build tools that will be forever stay free for all users. We don't want to introduce any kind of limitations, subscription fee or something. We want to really be sure that this resource remain free for everyone. For those pathologists who cannot afford uh, textbooks or subscriptions to different diagnostic tools, they still will be able to freely use it, see cases that occur close to their regions, and make better diagnosis, as like you said, which is a basis for better treatment and for better patient outcome.
I think it's a good time to call to this action, because it's end of the year. No, but taxes are in March, right? But still, it's end of the year, giving time, Thanksgiving in the US as of the time of this recording, and Christmas coming up soon. So if you or your organization, um if like cancer treatment and fighting cancer is a cause that you want to contribute to, there is an option to donate to keep it free forever. We were talking last time that it costs significant amount of money to put this all together and maintain it, and it's all based on donations. I did a small donation. I'm gonna do another one later, but in the show notes or in the description of the video, we're gonna or on the website, where can we find this link to donate?
If you just look at the landing page, you should see a donate
Let
button,
me
which
go
is
here.
pretty prominently displayed. If you go to the landing page of
Yeah.
the website,
So when you go to the website, you can see on the right, in the right upper corner, you can donate and you will get a receipt. Is this donation tax deductible? Yes, it is. And you can claim donation as deduction. So for all those, it's a nonprofit, and you can donate in different forms. And I'm going to link this in the show notes and description as well, but it's very visible on the website. um, let's talk about the website, because this for those who are familiar with the digital pathology software, like when I looked at it, I knew what it was built on. It's super clean, easy to navigate website that hosts like normal website components like about us, resources, and all different things. But the most important thing is that it hosts whole slide images. Let's talk about your partner in building this website, Yuri.
yes, that's very important, and we spend a significant amount of time. Talking to different vendors, and we ended up partnering with Path Presenter, which really we like, and I believe is one of the national and international leaders in the managing in building the system to manage digital slides, and we work with them closely to build the platform. As you can, if you when you remember when we look at the cases, they still look differently because we applied a lot of customization. We really asked to build this metadata part, which is a very different, and many search options are very difficult, but the backbone of it and how we can navigate and enlarge the slide and how they're stored and how they're managed, this is a Path Presenter platform.
Super intuitive, super easy to navigate. So Path Presenter, you can have a free account on Path Presenter as well, but you have to log in. This is something where you don't need to log in. You can just go and look at those cases. So I will be going on this website every now and then to basically show things on my YouTube channel as well, and always mentioning you and giving you a shout out. I think it's a fantastic resource.
Thank you. We appreciate any small or bigger support, because again, we don't have any commercial angle. we all care only about education and about providing a free resource for everyone. So any small or bigger support we can get, we deeply appreciate.
So Yuri, one question, educational support, and there is a very high quality standard implemented in submitting those cases. So let's talk a little bit more about your editorial board, and who are they and how are they curated those cases?
So maybe we can go back to the sort of this map of the world and the list of editors who are there. This, I mean, all editors, by the way, they are volunteers. They are not getting paid in any way or form for this. So these are pathologists who usually have a significant experience and are experts in that particular tumor type. So that's sort of, the only requirement is that they have to be geographically diverse, and not only geographically. Generally, we are looking for diverse group of individuals, but they are all pathologists, practicing pathologists who typically practice in relatively large centers, become experts and basically function as not only contributors, not only they submit their own cases, but they collect cases when somebody would like to submit a case, as we went before with you. I mean, they select an editor, submit the case. When editor receives the case, she or he will review it and look for first of all, image has to be good quality. Second, image has to represent the diagnostic entity. If not, they may ask to submit more cases. If it's invasion not clear, please submit case with invasion. And when it's fully, then look at metadata. Certain cases need immunohistochemistry for diagnosis. Many cases don't need. So when the editor is responsible to be sure that contributors provide all information needed to diagnose the case. And at that point, she or he will submit this case to the editorial board with a note. If it's a typical case, they say typical case ready for publication. Or they submit and they say case need editorial board discussion. I can tell you, for example, today, a few hours earlier, we had an editorial board meeting. And one interesting detail, maybe will be interested for your audience. So there is very limited window of the day where you can have meetings where all editors can participate. I can tell you, we had it at 8 o'clock of Eastern Standard Time in the United States. You can do it from 7 to 9. That's your pretty much window, because this is a time when Andrei Bychkov and Jian Liu, in China, they have the end of the day. They have 10, 11 o'clock. And that's pretty much the otherwise.
Okay, I'm showing them on the screen here.
Yeah. Yeah.
And Andrei was the person who told me about the World Tumor Registry in the first place at USCAP in March.
Yes.
When you guys launched.
And Jian she's from China, and she's doing the amazing job also recruiting the young pathologists who are contributors. So the difficult cases go to the full editorial board of 21 people of review. So many cases still go directly from the editor to me as a chairperson, and I would release them for publication. Some will go through the discussion of the whole editorial board if they're difficult cases, and when we agree on it, we go ahead and we post it for public use.
Wow. So how long does it take to, let's say, to submit a case that requires the full editorial review?
Well, if you're talking about the contributor who contribute case, really upload the case. If you have a normal internet speed, takes 2 to 3 minutes. Add the metadata, takes several more minutes. When you have all information at hand, it will take you 10 minutes to upload the case. Not a major. It will take editor, depending on how easy or how complex is the case, 5 to half an hour of time to really curate the case. And then best case scenario, it goes up to the chairperson. It will take me another 5 minutes to create, maybe to edit the note, and it will go to the public side. Sometimes some cases require much longer time. it going back and forth, editor send back to the contributor, please add immunostain, quality is not very good. Sometimes very simple thing, they scan the case, but the cover slip was dirty and there is too much dirt on the scan. We ask, could you please clean it and you resubmit? So sometimes it take longer, but overall, like you said, and I'm glad that you feel that way, that we try to build a very intuitive system, which is a lot of areas are pre-populated. Most of them
I
are
love that you guys have already the email prepared. That's the best.
Yes. So we really are trying to be very conscientious of people's time. But if you have an interesting case or rare case, or you're from the countries that is underrepresented, please consider to contribute, because it is all come to a common good, to pathology education around the world, and eventually will help patients to make better diagnosis and better treatment.
I love it. Thank you so much for joining me. Thank you for presenting this more in depth. And of course, it's the giving season. So here, donate button. If cancer research, cancer treatment, cancer diagnosis is something that you want to contribute to, this is a fantastic place to put some resources behind. And I'm going to link to this in the show notes. Thank you so much. I'm super excited about the development. So we definitely need to meet maybe in a year or whenever you guys have new features about treatment and everything you told me about. And I want to keep showing you to the people, and also make the patients aware that there is something like that. Maybe they can, if they know about it, they can also talk to their doctors, to their pathologists, and say, hey, would it be possible to contribute the case? Of course, if they feel comfortable, it's going to be de-identified, but it can help pathologists all over the world. It can help other patients, doctors, and together we can basically cure cancer. Well, maybe we cannot cure cancer, but we can definitely contribute to better treatment, better diagnosis, treatment, and patient care, and awareness. Awareness and education is the keyword here. Thank you so much.
Thank you. It was a pleasure being with you.
Thank you so much for staying till the end. It means you are a true digital pathology trailblazer. And as I said, if cancer research, cancer treatment, better cancer diagnosis is something that you care about, visit the World Tumor Registry website and find this donate button. Any donation, no matter the amount, will make a difference. And this is the first resource I'm encountering that actually unites everybody who's involved in cancer patient care. It unites the physicians, oncologists, pathologists, and gives the patient also access to the information that is used to diagnose their disease and determine treatment. You will be hearing more about it, so stay tuned, and I talk to you in the next episode.